Thank you. Thank you, Jamie, so much. I have been looking forward to this 2 hours do we have together? Hour and a half, 2 hours, so much, because I've been in practice for decades as a general internist, a primary care doctor. And it took me a long time to get sophisticated skills in how to listen to what my patients told me and tell me. And you all are the vanguard of persons who are brave enough, but also insightful enough to know that what medicine and healthcare needs now is not necessarily more fancy technical breakthroughs from the bioscientific pharmaceutical companies, but rather to deeply, humbly understand what persons endure and go through and triumph over as they go through illness. So that's why we're here, is for us to listen as those of you who have been learning with NPAF how really to tell these stories, how to bring them to those of us who are on the other side of the computer. I know that you all have been in rooms telling things to doctors, to nurses, to social workers, to emergency medicine people, and as we will hear in these stories that we are about to witness, rarely are the words of the patient heard, and rarely are the decisions and priorities of the patient what runs the care. We know that. And when you're talking with that nurse or social worker or doctor or chaplain even, and they're typing something on the computer, you have no idea what they're typing. So I got into the habit of, I would type into my computer what I thought was going on, but then I'd just turn the keyboard around and ask the patient, please continue writing the note. So all of us are committed to a healthcare that is shared and that doesn't belong to one or the other unless it belongs to the actual person undergoing the experience. I appreciate what NPAF has done. I've known of NPAF for years. In fact, I was Chris Wilson, who many of you may know in NPAF. She runs many of these programs. She was my graduate student decades ago, and I have been learning from her ever since. So come into this room, come into this living room, because we are living together, and we are living together, how can I say, under a sign of real equality and respect. And those of us who come here or who listen to your stories as healthcare workers are all the more in your debt, so that we can not just hear, but absorb. I call it metabolize. We have to metabolize what you tell us, which means almost like when you eat something, you eat it and then it becomes part of yourself. Well, what we will hear in the next hour and a half will become part of the selves of those of us who listen, meaning that our work, our actions, our respect to those who tell us of their experience will become part of how we live. I have read all of the stories we are about to hear. I cannot wait to hear them spoken, which is so much more powerful than just sitting on a page. And you all who have come to join us in this enterprise are going also to be transformed by what you hear, and I hope to be inspired to do likewise, to not be afraid to testify at a congressional hearing, to be interviewed by a journalist, to bring your concerns to the insurance company, whatever it takes to make heard the voice of the person who herself or himself or themselves go through the indignities and the triumphs of healthcare. Let us hear from you. So with that, let me pass this back to Jamie, and we will begin to hear one by one they're not our guests, they're our sisters and brothers in this work of ours.
Thank you so much, Dr. Charon. I couldn't agree more. I'm excited to jump right in. But first, I want to start with an audience poll and bring in some information from the audience. So our tech is going to launch the poll question. Have you encountered a healthcare provider experience that negatively influenced your level of trust? Yeah. And we'll wait to get some feedback from the audience. All right. Let's see what our audience thinks. Do we have results? Yes. All right. So 88% said yes, they have had negative experience that influenced their level of trust within healthcare.
Yep.
Yeah. Sounds about right. And it's going to introduce our first speaker, who is Vicki Wilson. She is going to be joining and telling us a fantastic story. Vicki came to us through our advocacy curriculum and has been a friend of NPAF for some time. Vicki?